Welcome to the Art of Marketing Operations, a Taylor podcast. I'm Glenn Bottomley, and today my guest is Justin Noznesky, Chief Marketing and Strategy Officer at AtriCure, a leading provider of innovative technologies for the treatment of atrial fibrillation, or AFib, and related conditions. Thanks for joining us today, Justin.
Yeah, thanks for having me. Happy to be here.
Well, Justin, you have a super unique career path because you started in accounting and then you transitioned into marketing. So can you briefly walk us through? That's a very unique journey.
Yeah, no, thanks. I started my career at Arthur Andersen. I thought that early in my career that being a finance professional was what I was going to do. Some through learning strengths and my own weaknesses, and others just providing me with incredible opportunities. Mentors of mine really encouraged me to think broadly about a business role. And really that's kind of the long and short of it. And I know we'll talk a little bit about how some of those experiences apply to what I do today. But really, it's there's a bunch of people in my life, in my personal and professional life, that have been incredibly influential for me and just helped me really think through what I wanted to do long term. So my experience at Arthur Andersen early on was an awesome one, and certainly very interesting for a long list of reasons. But it's really just a lot of great people along the way helped me really think through how I got to where I am now.
What a great path. I love that. And so what are some of the lessons that you learned from your time in marketing and sort of what you take into your daily work today in marketing? Yeah,
there's certainly a maybe not natural overlaps or might not be apparent, but really I think about marketing as being a lot about process. And what I mean by that is when you're making investments, when you're trying to determine who to hire, when you're figuring out who to consult with, it is a lot about process. So when you work in public accounting, it's also a lot about process. There's an audit process. There's teammates that you rely upon when you're putting together an audit or when you're executing on an audit. And at the end of the day, most kind of general, when I was, again, very early in my career, not really knowing what I was doing. But what you realize is that you do rely a lot on a team and you rely on subject matter experts. And that's really not dissimilar from what you do in what we do in marketing today. When we're putting together a plan, a campaign, an idea, a strategy, we're not doing that unilaterally. We're working as part of a team. It's really important for us to know what we're good at and what we're not. And so when we identify a gap in knowledge or process, and trying to identify who we can work with to fill that, I'm not naturally a quote unquote creative person. My wife and kids kind of laugh when they tell people that I do marketing now, because it's really not, a lot of people think marketing, generally your mind kind of gravitates towards creative elements. And there's certainly a lot of that in what we do here at AtriCure. But, that's, again, where I'm not naturally inclined to be super strong in that area. And so we bring in people, and we have people on the team who are just incredible at certain elements that, again, I might not be good at or somebody else might not be good at. So really it's about working as a team, running a process, being consistent in how we communicate with each other, who we hire, and who we're bringing in to fill some of those knowledge gaps. Yeah.
And to your point, it's, part of it's also, you're leading a team. So, it's your ability to identify where the gaps of the team are and what skill sets do you need? What does the business need? What do you need to grow? What does the team need a year from now, 2 years from now, 3 years from now? How do you build the bench strength? And to your point, you don't have to be the expert in every single, functional area in a marketing team or a marketing operations team, but if you know you need a certain skill set, having that ability to identify it is a really, really important skill.
Yep, for sure.
Yeah.
Exactly.
So how do you feel that your accounting background or do you feel that your accounting background has made you a better marketer?
Yeah, I think just building off of what you said and what we just talked about, I figured out pretty early on that maybe I wasn't a great accountant, and certainly not smart enough to be a subject matter expert in anything really technical on that side in particular. And so, again, working on a team, getting organized, removing roadblocks for people so that they can do their jobs really well. And I think that's, again, analogous to bringing in a tax professional. If you're working on an audit or if you're working in a finance function, you might be really good at accounting, X's and O's on that side, but there are tax professionals that are experts in what they do. And conversely, they're not experts in some of the X's and O's, debits and credits. So, really at the end of the day, it's just about bringing people together that can work together as a team. And I think that's probably the best way that it's helped me in particular.
Well, and, I want to build on that a little bit because obviously, you're working in the healthcare industry now, highly regulated environment. So what are some of the challenges that you run into in leading a marketing team in a very regulated environment? Obviously someone, a marketing operations professional who's in a for-profit space, an educational space, a nonprofit space, et cetera, that don't necessarily have as much regulation as healthcare does. What have been some of the things that you've seen are the challenges, but also potentially opportunities in marketing in a regulated environment?
Yeah, well, I would say some of the, and I guess I don't know if it's a challenge as much as it is just reality that we have to navigate. But there aren't really many industries in the world, and you mentioned a few others, that where you can definitively identify what products today I'm going to be selling or we're going to be selling 5 years from now. And so because it takes a long time, rightfully so, to bring new products and new therapies to market, they have to be rigorously built, rigorously studied. You have to take your time in educating physicians on how to properly, safely, and effectively use devices. In our case, we're making investments now that are impacting the company and our customers 5 years, 10 years down the road. And so that certainly can be challenging when you're trying to figure out what to build, how to bring it to market. When we launch new products, as an example, a lot of what we do very early on in a product launch from a marketing perspective absolutely impacts what's going to happen 5 years from now, whether that's from a positioning standpoint, a development standpoint, a pricing standpoint. There's just a lot of critical thinking and thoughtful analysis that needs to go into what we're doing now, because it's not just impacting our business in the next quarter or the next year. It's something these are lasting products. I mean, a lot of the products that we sell today, that we've been selling for a decade. And that's really, that's really because, again, it takes a long time to bring things to market, rightfully so, in a heavily regulated environment. So from a marketing perspective, we have to be really thoughtful. We have to be really critical in how we think about our own business, about what we're building, why we're building it. And then when we bring it to market, what assets we're investing in to help further these therapies. Again, it's a lot of things in healthcare have a very long tail, a very long cycle. And these are products that, again, impact patients for decades. And so that you're not going to be making a whole lot of meaningful changes to exactly what you're selling, but you've got to make sure that when you do bring it to market, that you're doing it in a way that can create a lasting impact on patient care, because going back and making a change later is sometimes very difficult to do when everything has to be, again, rigorously developed, rigorously studied, and it takes a long time to bring to market. So,
yeah. My father actually, before he retired, his last role worked in medical products and specifically pacemakers. And one of the things that he said, he loved it. He was there 15 some odd years, and it was so rewarding because every year they would actually bring patients, they'd gather all employees and they'd bring actual patients with their products in them And, they would talk about how, the company's products changed their lives. And my dad would comment about there was never a dry eye in the room, because it's you're making such a difference. To your point, is it's not just a product, but it is a product that is so critical. It is literally impacting people's lives physically, their lives with their families, et cetera. So it's got to be an incredibly rewarding experience in what you're doing every day.
Yeah, for sure. Patient testimonials and hearing from patients is certainly probably the most rewarding thing that we can do, and certainly there's so many. All medical device companies have different examples of how their products impact patient care, but it's awesome to hear, and we try to get as many of those good vibes going when we're talking about new products or how our products are impacting the marketplace. It's super rewarding, as you mentioned.
Well, and I'm just curious, just your thought here, just from an industry perspective. We've talked a lot on this podcast about artificial intelligence, and I'm reading a book right now, and it's called The Age of AI, and it's written by Henry Kissinger, Eric Schmidt, from formerly from Google, but they talk about how artificial intelligence now is speeding up the time to actually create, for example, a pharmaceutical drug or what have you. And one of the examples they gave in the book is about a certain type of antibiotic that was found, and to be able to bring a drug to market can take literally years, all the human trials, etc. And but then what they were able to do is they had this basically a very drug resistant bacteria, and they used artificial intelligence to scan 60,000 possibilities. They entered all the requirements into it, and they were able to determine the one that could, meet all the requirements, have no toxicity and all this stuff. So they were able to take what could have been literally a needle in the haystack that they might never find if they go through human trials. They were able to shrink that down. They already know the one that meets all the requirements. Now they can just test that one. So my question then is, how do you feel that artificial intelligence in your particularly medical products or implantable products, how do you feel artificial intelligence may impact product development cycles in the future?
Yeah, it's a good question. I think certainly the examples that you mentioned in the pharmaceutical industry, when you're dealing with a wide varying range of possible outcomes, is it's very relevant, and using algorithmic techniques or mathematical calculations of probability and success are super important. I think for us, it maybe plays less of a role in medical device development ultimately, because what we're making, it is not a chemical compound. It doesn't, it's a physical device, if you will. That said, there certainly are a lot of different ways that devices can be constructed. There's different measures of how you're calculating success. There's different, when you're running a clinical study, as an example. Anytime any medical device company starts a clinical study, or we say we want to go invest in a study to go to evaluate safety and success of a particular device in a particular therapy, you're always trying to do the math. Are we, what's our probability for success? How do we handicap our possible outcomes here? And ultimately, you're doing a lot of stats. You're using, and again, it might not be artificial intelligence in the same way that you mentioned in your example, but you're using statistics, and you're trying to project what possible outcomes are when you're designing clinical trials. I mean, we have an incredible clinical team, and they're constantly running stats, regression analyses, trying to figure out trying to figure out a range of possible outcomes, determining how big a particular trial has to be, how many patients need to be in it, what are the demographics of those patients. And ultimately, a lot of that comes down to, again, an algorithmic, thoughtful process using, a whole lot of input, but also a lot of modeling to figure out what what might need to happen. I mean, we do we're using big data much more regularly to help us understand the impact of our devices and the therapies that they're being used in. We're using large data sets and using retrospective or looking back on actual patient outcomes using Medicare data. And all of that, again, is in this kind of general big bucket of big data, artificial intelligence. How do we leverage this to help provide better patient care and better solutions for our customers?
Really, really fascinating. I appreciate that input. And I'd like to kind of dig in a little bit on that, the analytical side, the data side, et cetera, that what recommendations would you have as to how marketing operations teams can leverage analytical thinking to ensure that marketing initiatives are in fact successful? Obviously, we've got so much data, so much MarTech, dashboards everywhere, reports everywhere, et cetera. But what are some of the techniques that you and your team sort of kind of your go-to, either your, the way in which you do analysis or how you just use analytical thinking to ensure your marketing initiatives?
Yeah. So we certainly use kind of the modern quote unquote metrics that you mentioned when we're looking at success of campaigns or different initiatives. But I would say we also do a lot of partnership with cross-functional groups. So marketing teams working with research and development or finance or our quality systems teams to look at initiatives that we've done, products that we've launched, campaigns that we've run, and analyze both qualitative and quantitative metrics for how we did. So as an example, we use we look back on projects that we've done when we go into building a new product. Our teams do a lot of how much is it going to cost? How much revenue do we expect to generate from this? What are the margins for this particular product? And we'll go back and say, how close were we? What lessons did we learn? And that's a collaborative process that we use cross-functionally to go, all right, what can we learn from what we've done? How can we make sure that the next one that we do is going to be even better because of what we learned and how we actually did? So sometimes that can be a humbling process, but it's something that we use with our cross-functional teams to make sure that we're doing the right things and that, again, down the road, we're providing even better solutions for our customers and better care for their patients in what we're doing in the future.
And then let's take everything you just shared there. And now what advice would you give to a marketing operations professional who is not currently in a highly regulated industry, medical industry? Let's completely different, high tech. Maybe they're in a SaaS software company, maybe in, some other industry. What experiences that you have now in that healthcare space, as well as any other experiences that you've had, in other industries, what advice would you give to them in terms of how to make sure and measure and to determine whether their marketing initiatives are working or not?
Yeah, I think a couple things come to mind. One, like I mentioned, I think working together with the people that are producing what you're selling is something that's certainly universal. And so, in marketing, we're typically kind of the tip of the spear, if you will, but the construction of the spear is not done by marketing. I mean, we're responsible for representing something to our customers that ultimately was constructed or conceived by somebody else. And so, we might have input to that construction process, but ultimately that's not our job. It's not what we're good at. And so I think that working really closely with those peers is something that's universal across industries. So when you're selling an automobile, I imagine the people that are marketing automobiles are working pretty closely with their engineers. The people that are producing the automobiles are coming up with the designs for next generation automobiles on what they should be doing differently next time. And so that process and that collaboration is something that we certainly spend a lot of time on, and is something that, again, I would say is universal. So I don't know that You could call that advice, but it's something that when I think about what is applicable across industries and how what we do in medical device marketing or in healthcare marketing is comparable to other industries, I think that's what comes to mind first.
Well, it's an excellent point too, because another thing that feels universal is that how physical marketing impressions works with and works together harmoniously with digital marketing impressions. And this is a connection that works for brands everywhere. So how do you experience that? And how do you see that integration of physical and digital come to life in the healthcare industry?
Yeah, what we do is largely a people business in terms of how our products get delivered. So the best kind of manifestation of that is we have people out in the field, if you will, with our customers who spend their entire day educating physicians on the safe and effective use of our devices. They're in the operating room inside the hospital, and they need physical marketing assets, and they need to make a physical impression and have those assets be readily accessible when they're in the hospital every day. So it's not something that you can get a message to a customer through another means. You have to be there. You have to be physically present. And so for us, that physical impression, those physical assets are so important because that's really how we market what we do. And really at the end of the day, it's a consultation. It's an interaction. It's a physical interaction with our customers, with our physician customers. It's being physically present in the hospital. There's really no other way to do what we do as a medical device company where you have products that are being used by physicians every single day. So really at the end of the day, we're trying to marry what we can do digitally, what we can leverage through digital information, but you do it in a way that makes a lasting physical impression with our customers. And ultimately that's by enabling our people to have those assets be readily available. So, there's a bunch of examples, of that where we're just, again, trying to get our reps, our people out in the field to have available what they need to be able to do their job, which is be present with our customers, be physically present, co-located with our customers, and give them what they need, which is, again, information on safe and effective use of devices, of our devices.
Mm-hmm. Well, and there's something that you said that was very, very interesting about, that it's being physically present. And of course, you would hear that from a sales representative perspective. The sales representative is physically present. But also by having those marketing materials, whatever those are, it continues and allows that physical presence, even when the rep leaves, but it allows that physical presence to continue and extend that physical presence. And so it's an interesting way of looking at physical marketing because it allows you to even from a marketing perspective, extend the reach of your marketing efforts. That it's not just on digital, it's not just online, it's not internet, it's not advertising, but it just extends that experience of how a customer interacts with your brand.
Yeah, absolutely, and it goes both ways. I mean, we're, like you mentioned, we're trying to create kind of physical assets. There's a lot of education involved. Some of that is didactic in nature. So you're getting people in a classroom and you're teaching them. But how do we make that lasting? How do we make that scalable and leverageable? So one of a foundational pillar for AtriCure is customer education, physician education. And so we're doing that in a way that does require, in many cases, a physical presence, but we're also taking that physical interaction, that didactic training, and making it available in a way that's lasting. So we will record sessions, we'll make them available, we'll offer various means for that educational content to be available for people, for our customers after they might leave a course. So there's so many ways that these things are working together, and we're trying to make them work together so that those physical interactions are scalable, leverageable, and lasting in the future.
Well, and also to your point about education, what is one of the key lessons of teaching and of educating, and that is having multimodal. If I can hear something and then touch something and then see something and then feel something and then hear it again and then I'm reading it here and I'm seeing it again, it's just another avenue for you to increase retention of information because it's yet another avenue for that person, that customer to experience the brand.
Absolutely. Yeah. Yeah, absolutely.
Justin, before we wrap up today's episode, what is the main takeaway that you want to share to help understand the challenges facing marketing operations executives today?
Yeah, you know what? I think we hit on it. I mean, teamwork. There's so much new happening, and I'll give just one example of something that's been a trend in medical device marketing is what role the consumer plays in educating themselves about seeking specific treatments. So that's obviously been around for a long time. And you mentioned in the pharmaceutical industry, in marketing directly to consumers, but that's a changing landscape for medical device companies as well. And as we think about how we can better engage with the consumer, it's something that we certainly are not experts in. And so, there's reaching out, bringing in people that really know the space well, how we collaborate, how we operate as a team. There's absolutely no way that as a medical device marketing team, we can know everything. And certainly I don't know a fraction of everything that we probably need to know in order to execute on a really robust long-term marketing strategy. But what we do know and what we do need to be really good at is being cross-functional, being really responsive, working really closely with our partners. And so I think that's something that's universal to every marketing function, marketing executive in the industry, is just making sure that with the changing landscape of how information is being delivered digitally, physically, in all these different means, different social media platforms popping up all the time, how we leverage it, how we should be thinking about it. There's no way for us to keep up just on our own. So be good teammates, know when to ask for help. Those are things that I think is just going to be even more critical moving forward.
Fantastic insights. Well, that wraps up this episode of The Art of Marketing Operations. Thank you so much for joining us today, Justin.
Yep. Thanks, Glenn. Appreciate it.
Well, until next time, stay safe. Take care.
Thank you for listening to The Art of Marketing Operations, brought to you by Taylor. Don't forget to hit subscribe in your favorite podcast player. If you enjoyed this episode, please rate, review, and share. Until next time.